Effective communication, enhancing the patient experience. The principles of effective communication are empathy, active listening, clarity, respect, and cultural sensitivity. Empathy is the foundation of effective communication in hospice care. By showing understanding towards patients and their families and sharing their perspectives and emotions, we build trust, understanding, and connection. Empathy allows us to tailor our care to meet individual needs, address concerns, and provide comfort in times of distress. When we communicate with empathy, we create a safe space for open dialogue, foster meaningful relationships, and enhance the overall hospice experience. Active listening is a vital skill in hospice care, allowing you to fully engage with patients and families. Active listening is the art of giving full attention to the person speaking and responding thoughtfully. By being fully present and engaged, focusing on the patient or family member's words, tone, and emotions, maintaining eye contact, nodding, and asking open-ended questions, we show that we value and respect the thoughts and feelings of our patients and their families. Clarity in communication is crucial in hospice care. Our complex emotions and sensitive information are both involved. Clear communication helps to avoid misunderstandings and misinterpretations, ensure accurate understanding of patient needs and goals, builds trust and confidence with patients and families, facilitate informed decision-making, and reduces anxiety and uncertainty. By using simple, straightforward language, avoiding jargon, and confirming understanding, we can ensure that our messages are conveyed with clarity and compassion, supporting those we serve during a vulnerable time. Respect is the cornerstone of hospice care, where every individual deserves to be treated with dignity, kindness, and compassion. We show respect by honoring our patients' values, beliefs, and choices, listening actively and empathetically, valuing their autonomy and independence, being sensitive to their cultural and personal differences, and maintaining confidentiality and privacy. By treating patients and families with respect, we create a safe and supportive environment fostering trust, comfort, and peace during a challenging time. Cultural sensitivity plays a vital role in effective communication in hospice care, ensuring that patients and families from diverse backgrounds receive compassionate and inclusive support. Here are some ways cultural sensitivity enhances communication. Understanding values and beliefs. Recognizing cultural differences in values, beliefs, and practices helps tailor communication to meet individual needs. Respecting communication styles. Being aware of cultural variations in communication, such as direct versus indirect communication, helps avoid misunderstandings. Using culturally appropriate language. Using simple, clear language and avoiding jargon or technical terms that may be unfamiliar to patients and families from diverse backgrounds. Considering nonverbal cues. Being mindful of cultural differences and nonverbal communication, such as eye contact, physical touch, and body language. Involving family members. Involving family members in communication and care decisions as culturally appropriate to ensure respect for family dynamics. Addressing cultural concerns. Proactively addressing cultural concerns or fears, such as those related to death and dying, to provide emotional support. Being aware of power dynamics. Recognizing cultural differences in decision-making and power dynamics to ensure patient-centered care. Providing culturally sensitive resources. Offering resources and support that are culturally relevant and accessible. By incorporating cultural sensitivity into communication, hospice care professionals can build trust, foster understanding, and deliver compassionate care that honors the diversity of patients and their families. Strategies for effective communication. Use open-ended questions. Use nonverbal communication. Validate emotions. Provide regular updates. Involve patients and families in decision-making. Using open-ended questions in communication encourages patients and families to share their thoughts, feelings, and concerns, fostering deeper understanding and connection. Here are some benefits and examples of open-ended questions. Benefits include encourage sharing and expression of emotions with our patients and their families, gathering more information and insights, building trust and rapport, helping patients and families to feel heard and understood. Let's review some examples of open-ended questions. You may consider asking your patient, "Can you tell me more about your experience with your illness? How are you feeling today? What's been the most challenging part of this journey for you? What are your hopes and fears for the future? How can I best support you right now? What's most important to you in terms of your care? Can you describe what you're going through? How has your life changed since your diagnosis?" Remember, open-ended questions begin with what, how, or can you tell me? Encourage storytelling and sharing. Avoid leading or suggestive language, and foster a non-judgmental and empathetic space. By using open-ended questions, you can create a supportive and compassionate environment, empowering patients and families to express themselves and receive personalized care. Nonverbal communication is crucial in hospice care, as it conveys empathy and compassion. Facial expressions, eye contact, and body language show understanding and care. Builds trust. Consistent and genuine nonverbal cues establish trust with patients and families. Enhances emotional support. Touch, proximity, and nonverbal cues offer comfort and reassurance. Fosters connection. Nonverbal communication creates a sense of bond and understanding between caregivers and patients. Supports cultural sensitivity. Awareness of cultural differences and nonverbal cues ensures inclusive care. Complements verbal communication. Nonverbal cues reinforce or clarify verbal messages, ensuring clear understanding. Shows respect. Awareness of personal space and physical boundaries demonstrates respect for patients' autonomy. Creates a comforting environment. Calming nonverbal cues such as gentle tone and pace create a soothing atmosphere. Facilitates emotional expression. Nonverbal encouragement helps patients and families express their emotions. Enhances patient-centered care. Nonverbal communication tailors care to individual needs and preferences. By recognizing the importance of nonverbal communication, hospice care professionals can provide more comprehensive, empathetic, and patient-centered care. Validating emotions is a crucial aspect of effective communication in hospice care. It involves acknowledging and accepting patients' and families' feelings, helping them feel understood and supported. Here are some ways to validate emotions. Reflective listening. Reflect back emotions expressed. You might say, "I sense that you're feeling sad." Empathetic statements. Express understanding. You might say, "That sounds really tough." Non-judgmental acceptance. Avoid minimizing or dismissing emotions. Emotional labeling. Identify emotions. You might say, "You seem angry." Validation statements. Acknowledge emotions as valid. You might say, "Your feelings make sense." Avoid giving advice. Focus on emotional support rather than solutions. By validating emotions, hospice care professionals can build trust and rapport, encourage emotional expression, reduce feelings of isolation, foster a sense of safety and support, and enhance patient-centered care. Remember, validation doesn't mean agreeing with emotions, but rather acknowledging their existence and showing empathy. To effectively communicate, provide regular updates. Keep patients and families informed about care plans, treatments, and changes. Call, email, or text the primary contact after each visit. Involving families and patients in decision-making is crucial in hospice care, ensuring their needs and preferences are respected. Always encourage participation in care decisions and honor their wishes and preferences. Encourage honest discussions about goals, values, and concerns. Collaborate with patients and families often. Hold regular meetings to discuss care plans, goals, and concerns. Encourage patients to express their wishes for future care. Ensure patients and families understand treatment options and risks. Regularly review and update care plans to ensure alignment with patient and family wishes. Remember, involving patients and families in decision-making is an ongoing process that requires active listening, empathy, and collaboration. As a hospice professional, you will encounter several challenging conversations. You may have to break bad news, resolve family conflicts, experience cultural and language barriers, communicate with patients who may have dementia or cognitive impairments, or you may be facilitating difficult end-of-life conversations. When breaking bad news, be honest and direct. Show empathy and compassion. Use simple and clear language. Provide emotional support. And offer resources and referrals. When resolving conflict, stay calm and composed. Listen actively and empathetically. Focus on the issue, not the person. Seek common ground and compromise. Involve others if necessary, like a supervisor, social worker, or mediator. When overcoming cultural and language barriers, use interpreters or translators. Be aware of cultural differences and nuances. Use simple, clear language. Provide written information in the patient's language. Involve family members or cultural brokers. When overcoming communication barriers from cognitive impairments, use simple, clear language. Speak slowly and clearly. Use visual aids and gestures. Validate emotions and concerns. Involve family members or caregivers. When having end-of-life conversations, be honest and direct. Show empathy and compassion. Use patients' preferred language and terminology. Focus on patients' values and goals. Provide emotional support and resources. By using these tips and resources, you can overcome challenging communication situations that come up in hospice care. Remember, we have an interdisciplinary team here to support and elevate the end-of-life experience for our patients and those who love them. Ask for help and support when you need it, and don't be afraid to recommend a switch if there is someone on the team better suited to connect with our patient.